In May 2012, the World Health Assembly, the governing body of the World Health Organization, declared the eradication of polio as a programmatic emergency for global public health. At the time, Nigeria was one of the 3 countries where the polio virus was still endemic. In Nigeria, the highest burden of the disease was located in the northern region.
As at that time, thousands of children get crippled. More than 350,000 from the statistics, of those young children get crippled, and some died.
It came as no surprise when the 2012 Nigerian National Polio Eradication Plan listed Kano State as a high-risk, persistently infected state targeted for immediate intervention. In response to the declaration of the World Health Assembly, the federal government set up task forces on polio eradication at the national and state levels, and the Emergency Operations Center (EOC) to provide governance and coordination towards the implementation of the polio eradication plan.
Yes, Kano EOC has been was opened around 2012 when at the height of polio cases in Kano, when things getting polio out of Kano seemed mission impossible.
What is the EOC and what does it do?
It started way back in 2012 with the national at the federal level under the National Primary Healthcare Development Agency, and then 7 others, particularly in Kano, Bauchi, Kaduna, Borno, and I think Katsina and other states like that. From the name, Emergency Operations Center, it is a command center for decision makers in the health sector, and where partners now convene together to review data, and then this data is what is being analyzed for information to be obtained, and this information will help decision makers in doing the needful in the healthcare service delivery in the nation, and then the respective states where we have this EOC situated. Like here in Kano EOC, we have about 52 members forming the Kano EOC. So this is where we come together, and we now analyze data, and with a common goal, and this goal is for coordination. It's a coordinated mechanism that we formulate to manage the full implementation of polio emergency plan, and by extension, some other times it is not only polio activities that we run here in this center. It is no Milan calling it Polio Emergency Operation Center, but what we do here is far beyond that. Every important matter that has a relation with health in Kano that deserves critical thinking and appraisal is being conducted in this emergency operation center that we have in Kano. So this is what we do on daily basis. Whatever meetings we have a report to that, and on weekly basis we have a summarized report of all that takes place within that week, and on monthly basis we do the same. And this data we now analyze and then have information, and we have a feedback mechanism. All the facilities at all levels that we obtain data, we give them feedback, and then we transmit same set of data to the national also for the national use. So at every structure we consider a particular maybe structure or system that we work together with, and this thematic structure or technical working groups that we have at state level, we equally have same at the national level. So each technical working group has its own data that it feeds into the national technical working group for a generalized data for the nation as a whole. But in our own at the level of the state, we equally utilize that, and when we have the information, we give feedback to the lower levels so that they too will understand how far they are performing, and then they will have a gladdened heart to even do more quality jobs.
The Kano State EOC structure was designed to be a replica of the structure at the National EOC in Abuja, which is based on the incident management system.
As EOC, we have like 5 to 6 working groups. We have the operation working group, we have the data working group, the logistics working group, the communication working group, and the last one, access working group.
The Access Working Group is purely an initiative of the Kano EOC as it doesn't exist at the national level. The group targets undeserved populations such as hard-to-reach settlements and nomadic groups.
So this working group, Access, is responsible for identifying these underserved or rich areas, like listing them, identifying their locations, then identify the target population for that area, identify the total population for the area, identify different targets under 1, under 5, women of childbearing age. In case of any intervention, this outbreak, polio campaigns or measles campaign, Men A campaign, whatever campaign, or in case of any disease outbreak. The Access Working Group is also responsible for ensuring that these underserved areas were reached with all the required services.
The collaboration is the kind of a marriage of convenience it has to be. While the EOC that is more focused on the surveillance aspect is checking the truthfulness and the accuracy of our immunization coverage. For example, if we say we have 80% coverage in a state or an LGA, EOC through surveillance can verify or disqualify that. If, like that example I gave, if there is an outbreak of a disease picked up by surveillance, a vaccine preventable disease, it means that that coverage is an administrative coverage. Likewise, the immunization assists the surveillance in such a way, if LGO state is silent in surveillance, they are not picking anything, but the coverage is low, it means something is wrong. So these two has to go hand in hand. And if you look at the structure we have in this state, the deputy IM in the AOC is the state immunization officer, who is a member of CERIC. The deputy SIO is the deputy PM. So whatever is happening in CERIC, there is a mirror of that at the EOC.
The partnership has benefited the state immensely, as Kano State has had no new cases of polio since 2014. In addition to polio, the EOC serves as a coordinating center to guide and mount states' response to epidemic-prone diseases and even outbreaks. With wild polio out of Nigeria, the Emergency Operations Center in Kano State focuses on keeping the state prepared for and ready to respond to other epidemic-prone diseases and public health emergencies. The Kano EOC continues to play a pivotal role in sustaining the state's polio-free status by ensuring that surveillance and routine immunization systems stay functional.